Dr. Ashton Blessey is back with us on Studio 10. Good morning.
Good morning.
Good to see you again.
Good to see you too.
All right, you're from Springhill Primary Care, and today we are going to talk about the thyroid. First off, very basic, very simple for people who don't know. What is it?
Well, the thyroid gland is an endocrine gland that's located in the neck that wraps around the windpipe. Its main function is to regulate the metabolism of the body. For instance, the body has different types of cells: hair cells, skin cells, heart cells. And the thyroid gland secretes a hormone called the thyroid hormone that regulates the speed of all these cells at the same rate so we can function as unison.
Very important. Now, some problems can develop. Can we talk about some of those problems with the thyroid?
Well, the most common problems with the thyroid are really three. The first problem is sometimes patients can develop an abnormality of the thyroid to where it can enlarge or it can develop nodules.
Okay.
When that occurs, there is some concern with the nodules that there may be a risk of cancer. Certain risk factors are associated with the development of cancer in the thyroid. One is prior radiation, and I don't mean radiation doses to when we shoot x-rays on patients, but higher radiation doses. For instance, nuclear blast, or back in the 1940s, they used to have these x-ray machines in shoe salesmen used to have, to where they would radiate the foot to measure the size, and that sometimes provided an excessive amount of ration to place people at risk. Other risk factors for cancer with the thyroid are increasing age, family history of thyroid cancer are important also. So if someone develops an abnormal lump in their thyroid that's visible, certainly that always needs to be evaluated by a doctor and may need a biopsy.
How does thyroid disease relate to blood pressure as well?
That's a good question. Since the thyroid hormone that's released from the thyroid gland binds to different cells, it affects the ability of the heart to pump or not efficiently pump, and that can cause a rise in blood pressure in patients. Actually, there's two different types of thyroid diseases. One is if the thyroid gland does not make enough thyroid, we call that hypo or low thyroidism. And then if the thyroid makes too much hormone, we call that hyperthyroidism.
Okay, so are these problems something you will notice, something you'll come in to get treatment for, or should you come in before to try to prevent it? How do you go about attacking this?
Usually there's two approaches on that. Usually patients with low thyroid disorders will complain of symptoms such as weakness, fatigue, weight gain, which are very common symptoms. So when patients come in with those symptoms, often we will check a thyroid hormone level.
Okay.
On the other hand, hyperthyroidism speeds up metabolism, and the symptoms patients would have would be increased heart rate, increased breathing, weight loss, changes of the skin and of the eyes, especially enlargement of the eyes. We call that exophthalmos, which we see in patients with Graves' disease, which is the most common type of hyperthyroidism.
And if you're experiencing any of these problems, of course, you can go to Springhill Primary Care, Internal Medicine, to get it checked out. Dr. Ashton Blessey, thank you so much for joining us on Studio 10.
Thank you again.
All right, appreciate it.